Good afternoon. My name is Marla McGinnis, and I'll be your moderator for today's news conference. Before we begin, I'd like to introduce the Honourable Tim Houston, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Marla. Good afternoon, everyone. I want to start with the current COVID situation in Nova Scotia. As of today, 25 patients are in hospital, admitted due to COVID, and 3 of them are in the ICU, so 25 and 3. And as expected, our cases remain high. Today, we're reporting 522 cases. Over the last 2 weeks, we've reported almost 7,600 cases, 7,594 cases over the last 2 weeks. But thankfully, like other jurisdictions, we're not experiencing the level of hospitalization and severe illness with Omicron that we've seen with previous variants. The public health team is watching the hospitalizations very closely, as those 25 patients in hospital and 3 in the ICU are key indicators. In previous waves, most of us probably only heard of someone getting COVID, but right now in Nova Scotia, pretty much every one of us knows someone who has had it, or maybe they've had it themselves. It's different this time because the variant is extremely contagious. It's not just here. It's everywhere that this is happening. Look at what's happening around the world. Over the last 2 days, France, Britain, Italy, Spain, Portugal, Greece, and many others have all registered record numbers of new cases. Other provinces are also hitting records. The reality is Omicron is everywhere, and the return to 0 case days is a ways away. This naturally raises anxiety because we have been conditioned to fear COVID. And we must continue to have a healthy dose of fear when it comes to this virus. However, while Omicron is obviously extremely contagious, the evidence to date is that it is generally far less severe. So for those 25 families, COVID is certainly still severe, but 25 cases out of almost 7,600 total cases is consistent with data that we're seeing around the world, in that severe cases are the exception and certainly not the rule. Please keep this in mind as we talk about testing, boosters, and other issues. And we'll get to those issues. But before going to those issues, I do want to tip my hat to the many Nova Scotians who did not get time off this holiday season, including Dr. Strang and the entire team at Public Health, including the teams in the labs, the folks at our testing sites, those that are doing vaccinations, and everyone across the healthcare system and in between. Many of them did not get any time off over these holidays, and I want to recognize them and I want to thank them. When you think of the number of cases and add in their close contacts, tens of thousands of Nova Scotians have been impacted by the virus over just the last few weeks. This has put pressure on so many organizations, and you only need to look at the situation with the airlines to see the wrinkle effect of isolation and illness. Our healthcare professionals in the healthcare system are no different. This is a massive challenge in a system that is already severely understaffed. Our people are stretched thin. They're giving it their all. They're going above and beyond. So now we, as Nova Scotians, must match their determination and do our part so that they can do their job. This means some changes. No one likes change, but the world has changed since the beginning of the pandemic. The variants have changed, the vaccinations have been a game changer, and now we must also accept the reality in front of us, and that means change. First, it means that each of us has to take more personal responsibility. With stretched resources, we must ask Nova Scotians to take more personal responsibility. It's just that simple. You will see this in the way we're managing COVID cases to get at a more of a self-management approach for the less severe cases. You will see this in the back to school plan. You will see it in the rapid testing plan. You will just see that we're asking each of you to be more accountable. And I have faith in each and every one of us, every Nova Scotian, to step up for their family and step up for their community. Specifically, if you're sick and you test positive on a rapid test, you have COVID. Take personal responsibility for letting your contacts know, or let your school principal know, let your coworkers know, and of course, isolate. So we ask you to take more personal responsibility in a number of ways, and we'll talk more about that. But it also means we have to shift the focus to boosting. And that means a bit of a shift away from what I would call confirmation testing. The team is working hard to once again stand up additional booster clinics and add capacity to the system. We know being vaccinated protects people, especially against severe illness, and we know the booster provides increased protection. I know everyone is eager to get their booster shot, but on boosters, we're sticking with the NACI recommendation that the booster is most effective 6 months after your second dose. We're sticking with NACI on that. I told you before Christmas that we needed a supply of boosters, kind of laid out where we were. I want to thank the federal government for coming through with the supplies we need. We reached out to the federal government. We made an ask. There's been a number of discussions. They've been extremely accommodating. They're coming through with shipments arriving during the month of January. We expect to have the supply we need. This is incredible. And I can't express how appreciative we are to Minister Duclos, Minister LeBlanc, and the Prime Minister directly for their support. We've had a lot of support through the system, including our local MPs. So I thank them for that. But let's talk about where we are as of today, knowing the supply situation. Around 219,000 Nova Scotians have already had their booster or have their appointment. Many of these will be our most vulnerable, including our long-term care residents. So we recognize that that's a significant number. 219 is nothing to scoff at, but it leaves a lot of people that will become eligible for a booster in January, and that number is around 500,000, a little bit more than 500,000. So with the supply now available, we will open up a couple 100,000 new appointments on Monday. We feel the urgency, and the team is working hard to add even more appointments. But to add more appointments, we have to overcome two remaining challenges. First, we need more people. We need people to help actually get those vaccines in arms. This is our biggest hurdle, especially now that we have an extreme shortage and pressure of healthcare workers and on the healthcare system. The second hurdle is the actual physical venues. We're less worried about the physical venues, but I will tell you, I'm worried about getting the human resources to ramp up the booster program. I can tell you that from the second we heard that the supply was coming, the team dropped everything and focused everything on rebooting the system to get as many doses as possible in arms as soon as possible. So here's where we are. I mentioned that due to efforts of the team over the holidays, we can add a couple 100,000 more appointments. As such, on Monday, we will open up booster dose bookings to anyone over 30 years old who meets the NACI recommendation. To do more than those 200,000-ish additional appointments, and meet the full need during January, with less people having to wait into February, we need some help. We need more people. So if you're a retired nurse or doctor and are able to fill shifts vaccinating Nova Scotians, please put your hand up. Or if you have experience immunizing, whether you're currently working, a student, retired, whatever the case may be, please come forward and help us. There's a minimum time commitment and some training involved, but it's very streamlined. You can go to, there's a website, www.nshealth.ca/COVID jobs. We'll make that available, but there's a website, you can put your name forward. I do want to acknowledge that I've heard from many former healthcare professionals who did this last spring and didn't hear back and were discouraged. Please know that we have heard you. We've redirected resources to appropriately respond to those putting their names forward. We do need your skills. And the more people we get, the quicker we can do this. But while all of this is happening, we are continuing with the delivery model of pharmacies, and we're adding clinics where possible. The first new mass clinic opens next week. It'll be at the Halifax Forum. It will be up and running for appointments starting on Wednesday. And the team will be working to roll out other clinics and mobile clinics across the province as the program ramps up. We'll be using community clinics in the eastern and western zones. They've been doing testing. What our plan is there is to split their time between testing and vaccinating. Things are happening. We are doing everything we can to get you your booster as soon as possible. But please have patience. Keep checking back and book your appointment to get that extra layer of protection. These boosters are another step in putting the pandemic behind us. A final note on testing. There have been a number of reasons for the changes to the testing situation, and vaccines are one. Being more focused in our testing approach allows us to add some booster capacity. For example, as I mentioned, using clinics for testing in the morning, but boosters in the afternoon. These are the types of changes that are happening. Before I pass it over to Dr. Strang, I do want to acknowledge the incredible emotion that's in the air right now. I can tell you I feel it. I hear it. But please, please know that the team at Public Health and your government has only one thing on its mind. That's your safety. There are those that are trying to cast doubt on Dr. Strang's approach to managing this wave. We hear the naysayers. Some of them maybe questioned him every step along the way of this journey. But I will say that with the amount of emotion in the air right now, it's not fair. And frankly, to criticize and question Dr. Strang and Public Health, the team that has led us quite successfully through the pandemic, it's just wrong to do that. No one should stand for people questioning Dr. Strang's integrity or the advice he is giving. The reality is this variant is different and the world is different. Therefore, the response is different. Dr. Strang and his team have my full support. And I know he has the support of Nova Scotians, and because Nova Scotians know that he has our best interests at heart. So we'll get through this. There's a lot happening. Changes will be made as more information dictates that changes will be made. But I want you to know that there's a lot happening to keep you safe. So over to you, Dr. Strang.
Well, thank you very much, Premier, and good afternoon to all Nova Scotians. I am optimistic that the relatively consistent case numbers in the last number of days are pointing to a leveling off of COVID activity, and hopefully soon starting a downward trend. The Omicron variant has been characterized as generally producing milder illness, but it is yet unclear how much is the virus itself or ongoing vaccine protection or most cases being in younger adults. But we do know that since the variant has taken hold, our hospitalization numbers are climbing modestly. We're now at 25, as the Premier said, and 3 of those 25 cases are in ICU. So those are signals we need to pay close and careful attention to, that we need to make sure that our levels of severe illness are held within the capacity for treating those individuals within the finite resources in our hospital system. And as the Premier said, and as I've said before, that Omicron is forcing us to do things differently. It's a different variant and requires a different response. We no longer need to identify and have public health manage every single case of the variant, because for most people, it will result in relatively mild illness. So we need to focus our efforts and our resources on our most vulnerable groups and settings so that we minimize severe disease and protect our healthcare system. We do need to pay attention to our hospitalizational numbers and those who are getting the most severely ill, far more than daily case counts. We certainly have enough testing going on to monitor the where we are on the epidemic wave, whether we're going up, stable, or going down. But we do not need to continue to focus on counting every case and having accurate daily case numbers. We need to look at trends and need to then look at indicators of severe disease. And so that's part of why we're moving to more self-management and different testing options. And it's why we're not going to be contact tracing every single case of COVID-19 by public health, even in schools. Just because public health isn't doing the contact tracing doesn't mean that we're stepping away from that. We're asking Nova Scotians to take on much more of the role themselves of identifying who their close contacts are and notifying them. Omicron is all around us, and there's the best we can do is to slow down its spread. We have to recognize that that you could be exposed anywhere, and as the Premier said, we're not getting down to 0 cases anytime soon. It's about managing and slowing down the spread, but not eliminating it. And I'm not saying this to worry you, but we do need to be realistic about what we can do and need to do to manage this wave, and what it means for all of us going forward into 2022. I fully recognize that this is a big shift from what we've asked you to focus on and pay attention to for the last 2 years. But we're asking for the help of all Nova Scotians. All of you have practiced good public health measures. You followed restrictions, and now we need you to help with case management and testing too. If you're sick with cold or flu-like symptoms, assume you have COVID. Stay home and get a test, whether you fall into the rapid or PCR testing stream. And if you're positive, tell your contacts and isolate. And that information is on our COVID websites, both government and the Nova Scotia Health Authority, all the details about self-management. We'll likely never go back to managing cases the way we did before the Omicron variant. In fact, I hope we don't need to, because that means we're moving closer to really living with COVID-19 and living normally with a certain level of the virus circulating in our population. But we're not there yet. We're in a difficult transition period due to Omicron, but we will get there. I know the shift is hard and not everyone will support it. For some, it's too far, and for others, it's not far enough. I just ask that you keep trusting the team that has led you through this so far. If the steps we are taking don't work or we need to change course, we certainly will. We also know that vaccination remains critical to reducing severe illness and death from the virus and for protecting ourselves and others. And I encourage everyone to get their first and second dose if you haven't already, especially children aged 5 to 11, and for those of you who are eligible to receive your booster dose. As the Premier said, starting next week, Nova Scotians 30 and older will be able to book their booster dose as long as it's been at least 168 days since their second dose. There aren't many appointments available today, but more Moderna appointments will be added to the booking system for clinics across the province next week. I know that some people will be looking for Pfizer, but I have to talk to Nova Scotians directly, and there is no need for the ongoing brand preference for Pfizer if you are 30 or older. I've said many times since we started our vaccination that mRNA is the better vaccine, but it doesn't matter whether it's Pfizer or Moderna. They are both effective and very safe. When it comes to booster doses, in fact, some studies are showing that Moderna is actually slightly more effective as a booster dose. We're also expecting limited shipments of Pfizer due to global shortages of this vaccine. As a result, we will be prioritizing the use of Pfizer vaccine for people under 30, because while it's still rare, we know that Moderna vaccine has a somewhat higher risk of myocarditis and pericarditis in this age group. So in fact, we're strongly recommending only Pfizer vaccine for those under 30. Therefore, those who are 30 and above, we need you to start using much more Moderna vaccine. So if you're 30 or over, please do not wait for a Pfizer booster. If you can find a Moderna appointment, book it. And be patient. If you don't see an appointment in a clinic near you, check back often. We're, as the Premier said, we're aggressively working to open up more and more opportunities in the days ahead. Well, speaking of boosters and appointments, the Premier outlined the steps we're taking to increase capacity to immunize more people more quickly across the province. Our pharmacy partners will continue to be critical for getting vaccine into arms, but we're also bringing back community vaccine clinics and exploring other options. We want and need to get Nova Scotians their booster doses as quickly as possible. And to make this happen, we need help. All our efforts to expand opportunities for vaccination hinge on having enough people to deliver the vaccine. Healthcare workers with this skill have stepped up many times throughout our vaccine rollout. But we know that the Omicron wave has created challenges and pressures within our healthcare system. And while we can redeploy some staff and look at different ways to run clinics, we know we need more immunizers no matter what. We also need people with different skills to support the running of community clinics. Nova Scotia Health Authority is working to enlist the services of existing and retired professionals to administer vaccine. So if you have the skill set to administer a vaccine, or if you want to help in a clinic in a non-medical role, please sign up. We need your help to get Nova Scotians the protection they deserve as quickly as we can. And more information on how you can do this is at www.nshealth.ca/COVID jobs. And there'll be more to say about additional clinics coming online next week. Before I wrap up, I want to clarify in a couple of areas. The first is on reporting rapid test results. Earlier this week, I indicated that you do not have to report a positive rapid test result. That, in fact, was incorrect on my part. We are encouraging people to notify public health so they can provide you can get information about what the next steps you need to do to manage yourself and your contacts. So simply, you can email your name, date of birth, health card number, and contact information to public health, capital POCT @nshealth.ca, and that is on our websites. I also want to talk about masking. Based on new national guidance, we have updated our recommendations on masking. We've already updated our guidance for health care settings with measures specific to those who provide direct patient care in the presence of suspected or confirmed COVID-19 cases. My colleagues in occupational health and safety are also looking at what changes may be necessary in a variety of non-healthcare workplaces. But for the general public, we are now recommending a properly fitted 3-layer non-medical mask or cloth mask, or a properly fitted medical mask. We're not recommending one over the other, but regardless of which mask you choose, it needs to be 3-ply, and the fit and wearing it properly are as important as the type of mask you choose. Wearing a mask properly means it needs to cover your nose, mouth, and chin, all 3. There shouldn't be gaps between your face and your mask, so check the top, sides, and bottom edges for air leaks, and adjust the ties, ear loops, or nose piece to get a snug fit. And unless you have a valid medical reason for not wearing a mask, wear a mask where it's required. No excuses or loopholes. It's simply not too much to ask. And we're about to enter 2022. It's hard to believe that it's been more than 2 years since the first cases of COVID-19 surfaced in China. No one would have predicted we'd still be battling this virus with restrictions and strict public health measures. No one dreamed that after all this time we'd be facing our highest case numbers yet. But I'm also not sure people would have said that Nova Scotia would fare as well as we have either. Yet here we are, still going, tired, fed up, but still fighting the virus, supporting one another, and doing what needs to be done. And I do want to take a moment to recognize the many people in public health, our labs and testing centers and vaccine clinics, who once again have put their work to protect Nova Scotians ahead of themselves and their families. I know this is coming at significant personal costs, and you have my deep thanks, respect, and appreciation. And in ending, I truly believe that and hope that 2022 is the year we find our new normal, the year that COVID-19 starts to become part of our history and not our future. So I wish everyone watching and your families a happy, healthy, and prosperous new year. Back to you, Marla.
Thank you, Dr. Strang. We'll now take questions from reporters in the amount of time that we have. We'll take one question and one follow-up. We'll begin with Keith Doucette with the Canadian Press. Go ahead, Keith.
Good afternoon. I'm just wondering, this is a bit of a major shift for Nova Scotia in terms of the way we've rolled out vaccine in the past, and the new emphasis on quickly getting boosters into the arms of as many people as possible, as fast as possible. I wonder, Dr. Strang, what exactly is driving that? Is it the rapidity of the spread of the virus, or is it the emerging evidence that the more you are vaccinated, the better chance you will have keeping people at a hospital, or is it a combination of all of those things?
So first of all, it's not a major shift. We're going back to, we used community clinics a lot last spring. So we're going back to that model, knowing that there is a need to immunize large numbers of people in a short period of time, which is exactly why we used the mass clinics last spring. But the justification now is simply that now we have, with the cooperation of the federal government, a much greater supply of vaccine much earlier than anticipated. we need to get that vaccine into people's arms as quickly as possible, because a booster dose does give people the best possible protection against COVID virus. So 2 doses, it gives you good protection against, especially against severe disease, but it's not great against preventing any infection and therefore the ability of people to transmit the virus. So by getting as many people as possible boosted as quickly as possible, we are getting additional protection against severe disease, but more importantly, we're really reducing the chance for the virus to be spread.
Keith, do you have a follow-up question?
Yes, I do. Thanks. And I'm just wondering, since you're ramping it up and you've put out a call for extra workers, roughly how many are we going to need? Just so people can maybe sense the urgency. If you're going to do this, you're going to need people to put it in people's arms. So I'm just wondering, can you give us a ballpark figure at least about how much you're short and how many people need to step up?
I'd have to go back. I don't think we have a clear number on that. I think the bottom line is the more people we can get, the more vaccines we can deliver in the shortest period of time. So we need anybody who's got the ability and the time, whether they have experience giving vaccines or many of the non-medical roles that are also necessary to run a community clinic. We need people to come forward, put up their hands through the ways we've identified, and that we need as many people as possible. The more, the better. It allows us to go, the more there are, the faster we'll be able to roll things out.
Okay, we'll go next to Sarah Plowman with CTV. Go ahead, Sarah.
Dr. Strang, I'm wondering if you could break down the hospitalization numbers for us. I'm just curious, since there are some outbreaks at hospitals currently, how many of that 25 are people who caught COVID in hospital? How many of that 25 are people who were admitted to hospital because their symptoms were so severe they needed medical attention?
So the number we have been reporting, and the number today, 25, is based on people who were admitted to hospital because of the severity of their COVID infection. There are also other people who were and maybe because we test people when they come into hospital, that they may have been identified as being positive, but their reason for hospitalization wasn't COVID. That number changes all the time. And also we have some people who are also, because of now being exposed in hospital. And again, those are numbers that change. We look at those numbers, but for me, from public health, the most important number and the one that we report publicly is, out of all of our cases, how many people are ending up in hospital because of severe COVID infection. And so far, it's very low. We're probably less than 0.5% of our cases and of the known cases. And if we assume that there's many more cases that aren't known, our percentage of hospitalization is even below that 0.5%. So we're tracking that carefully, and so far we're seeing, but it is, ticking upwards, but we're seeing it a moderate rise, so which gives us some comfort, but it's also not enough to relax at this point in time. We have to be aware that we still have a number of weeks to go, and often hospitalizations can lag behind case numbers by a week or two.
Sarah, do you have a follow-up question?
Yeah, I'm hearing from people on the street, in my circle, that people are assuming that they are going to get COVID, even if they're following protocols and being careful. Can you help us anticipate what's to come? Should the majority of Nova Scotians expect that at some point over the next few weeks, we might all end up getting this?
Certainly, we're going to see there is lots of COVID out there. And if you're out and about in the public, there is certainly a chance of you being exposed. But it doesn't mean we should just throw up our hands and go, well, I'm going to get COVID, so whatever. So to me, it reinforces why all of us need to be extra careful. The choices we make about what type of activities we do, how many people we socialize with, wearing masks properly and strictly, keeping social distance. All those kind of things are even more important now, because all of us have a role to play in not stopping the spread, but slowing down the spread. This wave will move through our population, but we need to slow down the spread. So any any small proportion that end up in hospital, we can keep that at a level that is manageable over time and not have a huge spike in hospitalizations, because we let things just kind of go wild in terms of spread.
Next, we'll go to Amber Friday with Global. Go ahead, Amber.
Hi there, Dr. Strang. Nova Scotia Health has tweeted that rapid tests are only available for people experiencing symptoms or people who have been exposed to the virus. Are we running out of tests?
We have a large number of tests, and we've ordered a large number more, but we have to recognize it's a finite resource. And so we're at a point where right now we've had to focus both our PCR and our rapid testing capacity for those who need it the most, which is people who have symptoms, or if they're identified as a close contact, then they need that testing to be able to come out of isolation and return to work or other activities. Those have to be right now the focus of our testing. So we have people can go to our many PACs, primary assessment centers across the province for a PCR test if they're in one of the groups. We are also now starting to distribute rapid test kits through those primary assessment centers. So people who are eligible for a rapid test but not a PCR can make an appointment and go get a rapid test kit. And we are still in a couple locations in HRM handing out rapid test kits, and we are rapidly working in more rural areas, other points of access to rapid test kits as well, on top of the primary assessment centers. But we have to have people use use our testing methods responsibly. So as I said at the last briefing, we're still hearing stories of people, we've created a dependence on rapid test kits, and too many people are relying on testing and not changing their behaviors. They need to change their behaviors now, as I've just outlined, to minimize their risk of COVID and the risk of then spreading it to others, and not depend on a rapid test kits. And we certainly cannot afford people hoarding or stockpiling large numbers of test kits. Now is the time for us to be responsible for each other and use the resources we have where they're most effective and efficiently.
Amber, do you have a follow-up question?
Yeah, I would just like the verification of the 25 hospitalized. How many of those do have the Omicron virus, and how many of them have been vaccinated?
I don't have that data in front of me. We're working to get some of those details from the lab. You can appreciate all the pressures we've had with decreased staffing over the holidays. We haven't been able to keep on top of all of those detailed aspects, but we'll be looking to get more of that detailed breakdown in our hospital cases next week.
Next, we'll move to Taryn Grant with CBC. Go ahead, Taryn.
Dr. Strang, given the change in the approach to testing in Nova Scotia, what is the metric, or what are the metrics that you're looking at now and that the public can look at to know when we've reached the peak of this wave?
So I think we're looking at starting to move away from even reporting and counting daily cases, and we're looking at trends. One of the things we look at is what is our rolling 7-day average of cases, and starting to look at what is the trend over time. We're certainly still doing 8,000 PCR tests a day, which is more than adequate to be able to tell where we are at on the epidemic curve. Are we going up? Are we stable? Are we going down? But it's more important that we look at that with a longer period of time and not at a daily basis. And so we will have a good method to look at where we are on the epidemic curve. And as I've said previously, paying much more attention to the indicators of severe disease, which is people who are hospitalized, or whether it's a medical bed or an ICU bed, and really understanding those and what patterns of hospital admissions we're seeing. That's far more important than the daily case count now in the Omicron wave.
Taryn, do you have a follow-up question?
Yeah, again for Dr. Strang, with this large group of people who are going to be eligible for booster shots on Monday, do you have any concern about there being a mad scramble for all of these appointments, given that in the past we've seen the system crash when much smaller age cohorts were invited to sign up for appointments?
I mean, we certainly in the early days we did experience some of that. I think we've learned from that, and my understanding from the our IT colleagues is that they've robustly strengthened the system to resist that. But also we need people to understand that every system has capacity limits and to be patient. You will get. We're opening up a large number early next week, and we'll open up even more. So if you aren't able to get in right away, don't keep trying over and over and over again. Come, give it a bit of time and come back. Patience. We won't be able to immunize everybody that's looking for a booster on Monday or Tuesday, but we're building capacity to get people the opportunity to get immunized through the month of January and perhaps a little bit into February. So people will still have much greater opportunity to get immunized in a really short period of time, but we do need people to be patient as well.
Okay, next we'll go to Stuart Peddle with the Chronicle Herald. Go ahead, Stuart.
Thank you. Wondering about the Halifax hospitalization numbers. Will there be a point where you would be looking at moving cases out of the hospitals to other rural hospitals? Do you know? Can you explain what that point may be?
So, there's a lot of ongoing work. I'm not directly involved in it. It's led by the Nova Scotia Health Authority in terms of what their hospital capacity is. And as we slow down other types of healthcare, there is more capacity for COVID patients. That's part of the key reason why we're slowing down things. So there's always an ongoing look and adjustment of the type of patients and where they are best to be treated. That is looked at on an ongoing basis by colleagues at the Nova Scotia Health Authority.
Stuart, do you have a follow-up question?
Yeah, I'm going to swing a little bit to transit. Understand how much transit drivers have been asking for more mask enforcement and capacity limits on buses and transit. Can you speak a bit to that?
So, I mean, certainly capacity limits, that's within the authority of Metro Transit. We've always taken the position that for many people, transit is an essential service for them. That's the only reason they get around. So we have to be very careful that we don't exacerbate existing inequities by putting limits on transit. But ultimately, transit has that capacity. As I've said, our occupational health and safety colleagues are looking at any revised masking guidance for non-healthcare workplaces, and that would include transit.
Next, we'll go to Sarah Sabonsky with All Nova Scotia. Go ahead, Sarah.
Good afternoon. Premier, are we wondering if like other provinces, have to be offering to healthcare workers that if they test positive, they can go to work?
Look, it's an ongoing discussion, review. I mean, our healthcare system is stressed. Our people working in healthcare are under significant pressure, even without COVID. So once we start losing people because they have to isolate or because they're sick themselves, it's an incredible amount of pressure on the system overall. So this is something that we'll continue to review. There are some I call them working isolation protocols that have been in place for quite some time during this pandemic, at least anyway. If you're a close contact, there might be some things you can still do and still keep your colleagues and your patients safe. So we'll continue to look at that. But right now, I mean, it's amazing to me how kind of deep our healthcare workers have dug. They're digging deep, and they're making sure things continue to work. And I have every confidence that they'll continue to do that.
Sarah, do you have a follow-up question?
Yes. Are we recommending to people to stay home for New Year's Eve?
So our guidance is in place. We're not saying people have to stay home, but if you choose to socialize, do it carefully. No more than 10 people, whether it's your home or you're going to somebody else's home, or you're going to a restaurant, groups of 10. Make sure that group of 10 should be consistent with the same people you've been getting together with throughout the holidays. Careful masking, all those other rules. So yeah, we're not saying you can't enjoy New Year's, but like we said, like Christmas, Boxing Day, the last weekend, enjoy the New Year's and New Year's Eve, New Year's Day. Do it slowly and carefully.
Next, we'll go to Felix Arsenal with Radio Canada. Go ahead, Felix.
Thanks. Are the temporary closures that were announced in some of the hospital services, just to confirm, those are due to COVID outbreaks in certain hospitals?
So what I'm aware of is, and NSH has a lot more details, is we've had two reasons that three reasons. There were always slowdowns of services over the holiday period simply because of staffing reductions. There has been further slowdowns or maybe extension of those slowdowns to allow more capacity to deal with COVID. And then there have been additional pressures put on because of the large number of healthcare workers who whether they themselves are sick with COVID, or they may have been identified as a close contact and therefore have to be in a period of isolation.
Felix, do you have a follow-up question?
We've seen in Quebec yesterday that they announced that that period for isolation for some workers in the hospitals was going to get shrunk down. Is that something that you're thinking of doing maybe in Nova Scotia as well?
Yeah, we're like other provinces. We're aware of some recommendations that CDC Atlanta in the U.S. has reducing the time period for both quarantine and isolation. That only came out a couple of days ago, so I'm on a call later this afternoon with my national colleagues about that, and I've asked my team in public health to look at this on an urgent basis as we enter into next week. We need to look at are there any ways that don't add significant risk, but also help us deal with the workforce pressures, whether it's in healthcare or the workforce pressures that are being felt across the system.
Next, we'll go to Tim Bousquet with the Halifax Examiner. Go ahead, Tim.
Hi, good afternoon. Dr. Strang, in early December, you said that the province had the ability to get first doses of vaccine to 80% of children aged 5 to 11 before Christmas. I don't think we're even at half that mark now. Is there a particular problem, and does that suggest that there should be vaccination in schools or other such mass clinics for children?
No, we're at about 55%, I believe, roughly in there, of the 5 to 11-year-olds who are eligible have gotten their first dose. We certainly had capacity to do more than that. We're looking at that as we increase capacity and for boosters, and we'll also have increased capacity for children 5 to 11. So we'll continue to look at those numbers, and are there places where we may need to do more specific targeted outreach to children and families. Our focus now is to immunize large numbers of people in as short a time as possible. And there's certainly going to be lots of ability for 5 to 11-year-olds to get vaccinated if they haven't had their first dose, and then towards the end of January, we'll start to get all those kids needing a booster. So with schools going back in, one of the most important things that parents can do to keep their children as safe as possible is to get them their first dose if they haven't already gotten it. Critically important to get them immunized like everybody else.
Tim, do you have a follow-up question?
I do. On the rapid test reporting, many of people have contacted me about the security of emailing rapid test results. They say that violates all sorts of privacy issues and best standards. And they say that the better way to do it would be to have a secure web form on the provincial site so that they're not emailing who knows where their health information and age. Can you address that issue?
Well, we've stood something up rapidly as we've pivoted our testing strategy. I'll take that back and look at our digital team, but we put something in place quickly. I think it's important that people still use that, and we'll look at some of the security issues that you've identified.
Next, we'll go to Lindsay Armstrong with the Coast. Go ahead, Lindsay.
Thank you very much. Dr. Strang, you said you're looking to move away from daily case reporting, recognizing that weekly case totals are more representative of COVID activity. Obviously, this would be a major shift. I'm wondering when that might happen and why you're looking to stop the daily reports.
So we've been talking about this for a while, and we'd like to do it in coordination with other provinces as well. So we're having some. I'm gonna, as I said, we're talking about this. I'll be raising it on my national call today, as well as discussing it with other Atlantic provinces as well. It's it's something we need to not do a rapid or hard stop, but make a transition. And we've been looking at ways of how we might do that for the last number of weeks, but we'd like to do it in a coordinated fashion with other provinces and territories.
Lindsay, do you have a follow-up question?
Yes, thank you very much. For the Premier, you said obviously that staffing is an issue with booster rollout, and you've made a call for retired medical staff. Do you expect that this will be enough to cover the needs? And have you looked at hiring from outside the province, bringing in Red Cross or military support as we have in the past, if it isn't enough to cover the booster clinics?
Yeah, I think the answer is we'll do whatever's necessary. We want to get the boosters in the arms as quick as possible, as fast as possible. And we identified kind of 3 steps to that happening. One, we have to have the supply. So that was initially a challenge, but the federal government has really stepped up, and we're really thankful for that. So now we look at the next challenge is, do we have the human resources to make it happen? Do we have the physical spaces? So those are kind of the 3 steps. The first step, we have the supply. Now the second step is the human resources. So it's incredible the amount of appointments that have been opened up in January, just from the efforts of the team over the holidays. Very quickly, they got to work, and they've added a couple 100,000 appointments to the system in the month of January. That will go up. How fast that goes up depends on the human resources that have availability. So we put that call out. I suspect a lot of people will offer to help. We'll see where we're at, and then if we need to go further, we'll continue to go further. But we also, the discussions with the armed forces are happening as well. To the extent that they're able to send personnel to help us, then that'll get more boosters and more Nova Scotian arms even faster. So we feel the urgency, and we'll do whatever we can to get those people that are eligible their booster as quick as possible.
Next, we'll go to Lois Ann Dort with the Guysborough Journal. Go ahead, Lois Ann.
Yes, hello, thank you. My question is for the Premier and relates to the back to school plan. The latest school ventilation report issued for the SRCE was done in August, before classes were in session and before temperatures made open windows physically unpleasant. And the one-page report issued in August, covering 20 schools, gave no meaningful information to parents. Will the province consider random CO2 testing, which is an indicator of ventilation performance, when classes are in session, and make those findings available to the public?
But certainly something I'm hearing a lot from teachers and families, for sure. It's a real issue. There's no question about that. So I haven't had a chance to chat with the team about random testing, but I'll certainly personally open to that idea. We'll do what we can, and to the extent that there's shorter term fixes, we'll be happy to implement them. Some of them are longer term fixes. We understand that, but what my message to teachers, to students, to families is, we do hear you. We will do everything we can to keep you safe. Your safety is our number one priority. We want you to feel safe at your place of work. We want you to feel safe at your place of study. So we'll do what we can, and certainly your suggestion on random testing is one that I'll take back to the team.
Lois-Ann, do you have a follow-up question?
Yes, I do. Thank you. What metric would currently cause a move to online school, as daily case counts and exposures no longer appear to be the measure?
So I think we're working in schools. That really is going to become more down to an operational issue for operational logistics within a school, when it becomes no longer feasible if there's large numbers of either teachers or students who are having to be away from school because they have had symptoms and have tested positive.
Okay, our next question goes to Chelsea Gould with the Toronto News. Chelsea's having trouble with her audio, so bear with me as I read her question to you. Dr. Strang, can you describe if there is routine in-floor COVID testing for staff in hospitals? I understand there used to be regular testing, but that stopped last summer.
Yeah, I don't, that question would have to go to the Nova Scotia Health Authority. They're responsible from an occupational health and safety perspective for all the protocols they have in place for staff. I cannot give an up-to-date answer on that.
Okay, and the follow-up question is, you have updated your guidance on masking. Do you anticipate ever mandating these recommended masks into places where masking is required?
No, I mean, that'd be very difficult to enforce that. I mean, there are more stronger mandates around from a workplace health perspective under occupational health and safety legislation. But for the general public, that it really would have to stay as a strongly recommended or a strong recommendation. And like everything else, we know that the vast majority of Nova Scotians will follow public health recommendations, but it's not something that we would really see as be feasible to be enforcing.
Okay, next we'll move to Drake Lathers with the Port Hawkesbury Reporter. Go ahead, Drake.
I know you made corrections on the requirement to report positive rapid testing and also noting that the slowing down of contact tracing inside the schools, but I'm just wondering who's going to advise teachers, staff, and students of close contacts and potential exposures once school does resume?
So that's an ongoing discussion, but as we work out the details of the kind of school reopening plan, but again, contact tracing, moving away from contact tracing, it really means that you're not requiring all that notification. That what we're going to focus on is that both for students and staff, the key thing is if they have cold or flu-like symptoms, then they need to stay home, not be in school, and then test as appropriate, whether they're eligible for PCR testing or rapid testing, and acknowledging that there's lots of places around, whether it's schools or out in the community. We all have to live right now that there is a chance that we can be exposed to COVID no matter where we're going, and then conduct ourselves with the right personal preventive measures no matter where we are. And the key to that is focusing on keeping people who are clearly symptomatic and keeping them isolated at home and testing.
Greg, do you have a follow-up question?
Yes, I do. And this one might be for the Premier, but I guess what supports will be there for teachers or students who may need to provide or receive classwork for multiple days from isolating with a positive case?
Yeah, we'll continue to have those discussions with teachers. We've been through in this province online learning. It worked well for a lot of students. Some kids don't have the internet, so there's the device. There's challenges there. But we'll continue to talk to educators about what's possible and being ready to open up alternatives for those that need it. And I do want to go back to just to comment on the contact tracing. We've talked about how stretched the resources at public health are. We've talked about how stretched the resources at the Department of Health and working in healthcare are. They're stretched. So for those that say, like, when the question is who's going to inform them, I don't want the implication to be that they can only ever be informed by public health, because that's just not the case. They could hear from one of their colleagues. They could hear from, somebody in the community. We're just asking people to step up and be responsible and take personal responsibility. If you have COVID, let those around you know. If we find out that's not working and everyone's trying to keep it some massive secret that they have COVID and nobody's hearing anything, then we'll look at a change in course. But for me, I believe, I still believe in the goodness of people, and that people care about their community and they care about their colleagues and they care about their friends and neighbors, that when they have COVID, they'll let them know if they were in contact with them. So to answer your question very specifically of who's going to let them know, I personally believe it's any one of a number of people, and that probably actually a number of people will let them know. But if we need to change course, we will. But the reality is our resources are stretched. And the public health team is trying to put those resources where they can really do the most work to keep people safe. Right now, a lot of that's booster clinics. That's where a big effort is going. So we'll continue to monitor. If we need to change, we'll change. But right now, this is the direction from public health, and I trust it. And if something happens, which is unforeseen, that needs to switch to online or other learning, we'll do that too. We will do everything that's necessary to keep people safe. Right now, Public health has given us the direction as to what they think that is based on the information in front of them. And I trust them and I believe them. And I think Nova Scotians do too.
Unfortunately, that's all the time we have for questions today. Sincere apologies to the reporters we weren't able to get to. Premier, do you have closing remarks?
Yeah, thanks. Just quickly, kind of on that theme that we're just on. I would say nobody wants to get sick with COVID-19. Nobody wants to isolate and worry about not being able to work or care for their loved ones. Nobody wants to infect their family and friends. These are just things that nobody wants. But what everyone does want is a booster. And I want Nova Scotians to know that we're working very hard to get those booster appointments opened up. And I'm very impressed and proud of the work that's happened over just the last couple of weeks to open up almost 200,000 appointments for January. That's a good thing. We'll continue to work towards opening up more appointments, and I have every confidence that they will. We'll do that as quickly as possible. But ultimately, everything that public health is saying and doing is driving towards more self-management of COVID, more personal responsibility. And Dr. Strang kind of alluded to, and I've heard as well. I've heard from many different groups of people who have different feelings on what's happening here. One group is angry because they think things are too loose. Another group is angry because things are too tight with the restrictions and rules. And then we have some that are kind of standing there trying to drum up fear and questioning advice. But I just ask Nova Scotians to cut through all of that and know one thing. If I can leave you with one thing, it's that public health is leading a common sense approach to this variant that is appropriate at this time based on what they know. And if there has to be a change, things will change. But everything that is being done today is being done to keep people safe with an eye to some semblance of normal. Some sense of normal that includes activities and gatherings and hugs and handshakes and all of those things. But please follow the public health guidance. I trust them, and you should too. If you're sick, do a rapid test. If you're positive for COVID, stay home, isolate, notify your contacts. Do all these things in the name of your community, and please get vaccinated. So we're heading into New Year's. I firmly believe, I always believe that tomorrow will always be better than today. And I believe very strongly that we're all in for a very good New Year's, and I wish nothing but the very best to you and your family. Thank you so much.